Hello, my name is Dr. James Siegert. I'm a board-certified urological surgeon who practices at Specialty Physicians of Illinois in Olympia Fields in Chicago Heights. I've been in practice for 3 years now and been in the area my entire life. And I'm here to talk today about men's health, particularly men's health screening and what should be done from a urology standpoint. And when I think about men's health, it's something that I'm very passionate about, and I think about a few areas of the top concerns by which a man should see a urologist or should talk to his primary doctor about. And a couple of those concerns are an enlarged prostate, urinary symptoms, erectile dysfunction, and prostate cancer screening. An enlarged prostate is part of the aging process that every man goes through in some way, shape, or form, similar to balding and gray hair, in that there's not a whole lot you can do to prevent it. It's just more so has an impact on your life and quality of life. The prostate's a small organ about the size of a golf ball that sits deep within the pelvis. It starts growing in a man's 30s and early 40s, and then it's usually when about half of the men start to exhibit signs of an enlarged prostate. Those signs can be getting up at night a couple times to urinate, going more frequently during the day or more urgently, frequent bathroom breaks while you're at work or in the car, feeling like you're not emptying the bladder, or sometimes even some burning or splitting of your stream. Usually by the time a man reaches his 50s, at least 50% of men have symptoms of an enlarged prostate. And by the time a man reaches his 7th and 8th decade, in his 80s, usually the vast majority, if not all men, have some signs of an enlarged prostate. Now, an enlarged prostate is very different from prostate cancer. An enlarged prostate is benign growth of an enlargement of the prostate. And the symptoms that it causes are the one that cause some distress to your daily life but pose no overall impact on your health or longevity. But there's something that can be very private to you, very distressing, and something that should be evaluated by a specialist such as a urologist. And that evaluation is usually very simple. It involves usually a detailed history of your symptoms, an examination including checking your prostate, as well as usually a urine test and sometimes a blood test. And the purpose of that is to make sure that there's nothing else more serious going on, such as an infection or kidney stones or cancers. And once that entire workup is performed, it helps me as a clinician help to better improve your quality of life, your duration of sleep, and the symptoms that you're having throughout the day. And a lot of men don't realize how much their symptoms have changed over time, much like your vision. It's not until you get a new pair of glasses that you realize how much your vision has changed and was so out of focus. And when something evolves over the course of years to decades or more, it's difficult to appreciate a change. But oftentimes there's a sense of embarrassment that a lot of men think that they're alone in suffering, that this is part of the normal aging process, when in reality some of it is, but there's a lot of avenues for improvement of those symptoms. And that's a big reason why men should be more open to discussing this with their physician.